County.
Hello and welcome to this special edition COVID-19 Rogers Television program dedicated to informing you and your family of resources and services available in our community. Before I welcome our guest today to the program, my name is Carol Merton, and for those of you who watch the program, you know I like to say a few words of thanks at the beginning. So bear with me, I keep changing the message because the COVID-19 situation keeps changing, and we want to provide you with current information. So as we move through phase 2 of the reopening of our province, we celebrate the lifting of some of the public health restrictions and are hopeful that we can continue to move towards phase 3 of the plan. Significant attention to the details required to keep the public and employees safe is very clear and obvious in the various businesses and services that are reopening. However, we need to give them our support by following their instructions and their directions as we work together to prevent this spread and further spread of COVID-19. Everywhere we look, there are positive signs of recovery in the faces of loved ones, friends, and neighbors who are able to meet, greet, and participate in their own unique social bubbles. We know that this situation is fluid and we must stay vigilant to be able to continue to experience and enjoy the relaxation of some of these restrictions. We know, however, that the situation can change quickly and the number of COVID-19 cases continues to be monitored very closely by public health. Without a doubt, we in our community have forged new linkages, unique and unexpected alliances and networks as we continue to meet the needs of the community in this pandemic. We are all anxious to have our lives get back to normal, and we know that the new normal for us looks very different than it did a few months ago. We are also anxious to move forward, and those in the front lines are weary. Thank you to all in our community who continue to provide the supports and services needed, to the medical officer of health and the public health unit staff, all of our frontline, essential, and community support services for their ongoing efforts to keep our community safe. We will get through this together, and we will be stronger than ever. And on that note, I am absolutely delighted to welcome 3 guests to the program today. And I'm going to introduce them. And you will notice that 2 have masks on because they had an IT challenge, which meant they couldn't Skype from different rooms. So because they are healthcare, I'm delighted to see the masks, although I would have been happier to see your faces, but thank you. So we have with us, and bear with me if I get the name, not the names, but the titles wrong, please let me know. Paul Hoban, who is the Executive Director of the Owen Sound Family Health Team. Rona Cobean, who is the Program and Services Manager for the Family Health Team. And Karen Smith-Turner, who is the Executive Director of the Owen Sound Family Health Organization. How'd I do? Did I get it?
Perfect. Good job.
Thank you. I want to thank all of you for being here today. I had really wanted to get the information out about the Family Health Team and how it's meeting this COVID-19 challenge, how you've changed your practice and how you're going through recovery. But also, Karen, I'm very interested in knowing about the Family Health Organization and understanding the difference and how they link together. So who'd like to go first?
I'll start with the Owen Sound Family Health Organization. It's the group of 21 doctors that work together, serving about 36,000 patients across the Grey Bruce counties. We work very closely with the Owen Sound Family Health Team, so Paul and Rona as well. So there, Paul, if you want to talk about the...
Sure. We service the clients or the patients of the FO or the Family Health Organization. So we are the nurse practitioners, the dietitians, the pharmacists, the social workers, all the other healthcare professionals, the nursing staff, and we follow the lead of the Family Health Organization and the physician group.
So there's basically two organizations linking together to provide the services. But Rona, you also add an additional service, or besides the direct doctor, nurse practitioner role.
My own role, you mean?
And the programs, because there are actually lots of programs, and I'd certainly wondered if you could share the variety of programs that are happening.
Absolutely, yeah. So our nurses and our dietitians and our pharmacists and our occupational therapists, we run programs and classes. We do some one-on-one with those patients that the doctors from the Family Health Organization have referred over to us. We do some one-on-one teaching, but we do a lot of classes as well. So classes on like chronic disease management. Yeah. So looking after your blood pressure and looking after your diabetes and what does that look like? And the new devices that are out for diabetes, we run classes on those. A lot of group setting stuff that has been just changing recently.
Yeah. So there's been a significant change in how every one of you have had to run your business. I'm wondering if you can describe how it changed, and as we move through recovery, what you will do. I mean, classes can happen in classes, right? In groups.
Yeah.
So
from a clinic.
Yeah,
Sorry.
Go ahead.
From the clinic perspective, we from very early on in the pandemic, our goal was to help the patients and keep them out of the emerge wards. We were lucky to have a COVID team start together, made up of clinicians, including Rona, that set a lot of the screening algorithms that we do and the patient flow. And also one of their main goals is to limit the use of PPE that we do as well. Yeah. It's added a lot to the clinic. So
now the doctors themselves, they're not physically present at the family health team at this point. Is that correct?
No, there's a mixture going on. So we've been here all along.
Okay.
Everything just looks very different. Our physicians have been seeing patients. Okay. Most of it is virtual, and at the beginning, most of it switched to telephone very quickly. I would say that about 80% of our visits now are done virtually.
Yeah.
But we're still seeing helping patients.
Yeah. So seeing may not necessarily be physically face-to-face, but it's physically using technology.
Correct. That's right.
What was this a big adjustment for the doctors, and certainly for the patients it might be? How did it work?
It is a big adjustment, and for the patients, because they weren't sure whether to come or not. They essentially, the physicians are doing the calls. That we're scheduling calls in like we would schedule an appointment coming in. So we're using the same tools, physical tools, but the physicians are actually calling the patient. And where they deem appropriate, they will bring the patient in for an in-person visit.
So they're still connecting. It's just slightly differently, for sure. So do we have enough physicians to handle this? I mean, you named a lot of clients. I mean, where are you as far as, coping with the demand? Because people get sick. Even without COVID-19, they need care.
It's amazing, actually. Some of the regular colds and flus and strep throats have been down because everybody's washing their hands.
The science of hand washing. Yeah.
Yeah, so, I took a look at it the other day, and we're still handling at least 80% of what we were pre-COVID.
Wow.
As far as appointments go. That most of them are virtual though.
Yeah. Yeah.
It can be challenging because it's not always easy to connect via the telephone. So there's some challenges there, but they are working around it.
Yes. And what are you hearing back about how the patients feel about that kind of connection? What are they saying?
They
like
appreciate that. They're surprised that their physician is reaching out to them and calling and connecting, and they love it. Rona, if you talk to what you're doing, which is
so what we're finding is a lot of patients are enjoying it because previously they may have had to take a few hours off of work to get here, get to the appointment, come to the appointment. They're taking their 15-minute break to talk to their doctor or talk to their dietitian or talk to the pharmacist. And so initially when we first started into this and everybody was home, it was nice they got their visits. Now that people are like returning to work, it's interesting because people are really appreciating the fact that I don't even have to leave my work for my appointment.
Wow.
Yeah.
So at this point, do you anticipate continuing with this kind of virtual care? You may have a different term for it. In the future, post-COVID, and I look to a post-COVID day.
So from a family health team perspective, things will change. We will be far more virtual than we will be coming in and being seen. What we're finding is like Karen said and like Rona said, patients are enjoying it. They can get better service quicker and be more efficient. Some of our clinicians absolutely love it, but the fact is they're all very, very professional, and their sole focus is on patient care. And we do bring some patients in that absolutely need to be seen, but for the most part, virtually will be the way of the future, and it's exciting, I think, for clinicians, and I think it's exciting for the patients.
And one thing I'm hearing from a variety of organizations and businesses is, although COVID's been a black cloud, there have been silver linings around it, and often it's around the use of virtual technology. And certainly here in Grey Bruce with our winter weathers, there's an opportunity that storm or no storm, there's a way to reach out to people. So, Rona, how will you cope with groups? I mean, there's a lot to be said about the group interaction.
Yeah. So we've already actually started. We're just starting slowly to get our clinicians comfortable with virtual classes as well as the patients here as well. We have a fitness class that's run, pre-pandemic, we had a fitness class that ran twice a week. They've now started back up and it's virtual. So our OT runs it. They meet twice a week for over an hour. And from the OT perspective, she said the patients are loving it. We just did our first heart healthy eating class on Tuesday. That was virtual, and we're going to start ramping up those classes virtually. So it's good because, again, if we have people that, transportation is an issue, they can attend whatever classes they want because it's going to be in the comfort of their own home.
Which is, you raise the issue of transportation. We know that's a big concern here in Grey Bruce as well.
For sure.
That's another bonus, certainly, to the virtual care. So how will you measure the success virtually of some of the programs? Is it just by satisfaction, or will you have other measures?
Right now we're doing some satisfaction surveys. So after the virtual class, they would get a survey monkey that would come and then we can sort of measure the satisfaction and see if there's points where we need to modify, change, just sort of look at it a little different lens because it's all new for every one of us.
Yes.
There's going to be some learning curves for all of us to do. Yeah. For sure.
So will there be limits to the number? I know you have guidelines around group sizes. Are you limited as well by the use of the technology, or does this let this more change happen?
Well, the limitations we had around the group sizes was mostly due to the space that we had here and whether we had the classroom space. I'm not sure that that's going to be a limitation anymore because of it being virtually. Of course, you don't want too large of a class because there's always issues if people have questions and so on. But it's not going to be at all like it would be if we were having it here.
Yeah. So as we're looking through recovery and reopening, do you anticipate a time when things will ever be like they were? Are you going to be continuing? Oh, I see a big no there. Fill me in.
I don't see the inpatient, like we still have to, obviously, we need to see patients in person for certain things, but I don't think it'll ever return to all in-person visits. Patients just find it too convenient, and we can help them even more because there may have been some that wouldn't show because, again, it was too inconvenient. They couldn't afford to take often a half a day by the time they traveled here. Left work, got here, waited, did a 10-minute, 15-minute appointment, and then went back. It was very inconvenient. So we're able to help them more because we can see them more routinely.
Right, right.
We are social distancing. The waiting room's been all set up for that. We have to do that. It will stay. So we're doing. We're doing more electronically, even insofar as having forms come in rather than have the patients bring them in and hand deliver them. We're encouraging that they either take a picture, email it in, fax it in, mail it in, rather than drop it off in person.
Yeah. So there's always the discussion around how to keep personal health information secure. So can you talk a little bit about how you do that in your organizations? Because that's an important thing. And if virtual is great and security is important. So what strategies have you done to help people feel secure?
The platforms that we're using to do virtual care, the OT, we're using a couple of platforms that are secure, mostly OTN, which is a government platform that's out. So that's it's not right in our EMR, but it is secure. There's passwords. You have to have a OneID to sign in, which is very securely controlled.
Yeah. So, Paul, from your perspective, in your role, who would have ever thought that this would face a healthcare organization? Mm-hmm. What do you see as far as the future and how things will unfold around resources and programming? What are there changes that you're anticipating may happen?
There's certainly going to be changes in the way we run our business. And right now, I think where we can see this happening is it'll be a 50-50 split between virtual care and actually inpatient care. The Premier, the Minister of Health, and the Ministry of Health are all pushing towards virtual care, and that's where we take our most of our direction. From a family health team perspective. So that there's going to be huge changes, but it's really going to be dictated by the patient. We're not going to do anything that doesn't benefit a patient. So our sole focus when we try to make a change, whether it was last year or whether it's 3 or 5 years down the road, will be how does this affect the patient? If it doesn't positively affect the patient, we will never do it. If it positively affects the patient, then we'll try to make it happen. And that's what our focus will be. Our board of directors, the physician group, have all said the same thing. We want positive change that will positively affect the patient. And if we can do that, that's great.
So at the moment, the virtual care is for those patients who have a relationship already formed with their healthcare provider because they've attended. Do you anticipate a challenge with the development of new relationships, let's say, if you're able to take new people on?
Well, we have a program. It's called the UP program, so that introduces new patients to a physician through a nurse practitioner.
Okay.
So that's something that we'll continue to do, and that will have to be done in person. The first couple of visits, and I think the choice of most physicians or clinicians will be in person, but that's not going to be the case all the time. So that'll be the first choice, but and we'll definitely, our nurse practitioners will see the patients the first couple of times. But after that, once we get all their issues under control, I think what you'll find is that the physician will be able to then see that patient virtually. But that being said, I do not speak for the physicians. That would be something that Karen would do, and Karen is responsible for.
Nicely said.
Some people say I should be a politician.
Oh, heavens. Rona, from your perspective around programs and services, do you anticipate additional new things coming because of the technology or because of the limitations of the face-to-face? Or are there any exciting new things that you thought you'd like to begin but just haven't been able to for a variety of reasons?
I think we're growing with this. It's been a huge learning curve, as I say, for all of us. I think right now we're just trying to take the classes and the things that we have done before and get them ramped back up. Is there going to be new classes? Yes. There'll be a good opportunity for us to have different things and sort of delivered in different ways. But right now, as far as do we have anything new and exciting coming up? No, I'm still trying to recoup from everything being shut down. But yeah, our dietitians, our pharmacists, our OT, they're still seeing those patients one-on-one. Okay. If they need to see them virtually, over our platforms of OTN, they certainly are doing that. Lots of phone calls. As far as the classes and the services, I'm sure we're going to come up with some really great ideas moving forward. But at this moment, we're just trying to get those other classes that we had going up and going again.
And that's a really good point. Sometimes the new is the fact that you're redeveloping and being able to continue with what's a valuable service, but just in a different way. That's new. And it is exciting to be able to do that for sure. In the earlier part of the program, we talked a little bit about patients being afraid to come for service or care. I had the good fortune of being able to interview the hospital CEO, Gary Sims, and they had the concern with visits to ER as well. Are you seeing any backlash or any health concerns because people have been afraid and waited?
I haven't heard big things happening from the doctors. I know they've been helping patients out with the regular maintenance and care throughout. We are seeing an uplift in people were definitely not calling, and the phone calls were way down. Mostly even this week, we've seen a big uplift in phone calls coming in. Patients generally don't want to come in, so it's been another reason that the virtual care has been good, but we've still been diagnosing issues as we've gone along and worked through this.
Yeah.
And if I can interject just a little bit, sorry, Paul. We've been trying to, if patients do have that in-person visit, we've been sending out, the staff on the FO side have been sending out emails to those people with what to expect when you come in. So you don't have that sense of anxiety of, I don't know which way to go, like the arrows in the grocery store. Which way do I go? What do I do? So we've been, as a Cobean team, we've sort of put something together to make it seem a little bit more comfortable, and that ahead of time before you get here, sort of what the expectations are and what you can expect yourself.
And that makes a big difference.
Rona?
The COVID team that we have, which is part of, it's clinicians from both the FIT and the FO, have done an amazing job. They've watched things all along. They've made sure we were doing the right things with PPE. They make everyone's day more safe, both for our staff. Our staff are doing a great job as well, but for the physicians and the patients.
Yeah. Paul, you were going to say something?
Yeah, Rona put together a helpline also for patients. So patients can call and ask any question they want, and it can be addressed by a healthcare provider, one of our RNs or RPNs, and I think it relaxes the patient and puts their mind at ease when they're able to ask a question or a concern that they have, and it just makes it a little bit more comfortable for the patient either to come in or to deal with the issue that they need to be dealt with.
And the patient comfort is critical. Staff, absolutely. I think it's great. I mean, the initiatives and the work towards taking care of the patient as a top priority is very evident in everything that you've said today. So we have 1 minute left. Who wants the last minute to say those meaningful last words? Online booking is still possible, right?
It is.
Appointments can still be done. I'll say it for you.
Yeah. Call ahead if you're not sure whether you're supposed to come in.
Yeah, excellent. Well, I want to thank you for attending and just sharing the information, because it is very clear healthcare is a priority for our community, and we need to be able to attend to all ages and stages of life. So I wish you all the best as you move forward in this new adventure. And, for sure, we're all learning as we go, but it's amazing. The strength of the team is very evident, and I appreciate the time that you've taken. I want to thank our viewing audience as well for joining us today to learn more about programs, services, and resources available to you and to your family. Take care, stay safe, care for each other. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
What kind of show do you want to see on Rogers TV? What interests you? Log on to rogerstv.com, fill out a show proposal, and tell us about your segment idea. We want to know what you want to see. Rogers TV, only on Rogers.
I'm Mallory, and I was walking home one night when an impaired driver hit me. He had been overserved in 2 bars before getting behind the wheel. If the server